In order for us to understand how to mobilize someone at C0-C1, we have to understand the tissue. The tissue is an issue. We need to see how C0 moves on C1. C0 is a condyle sitting inside of a socket. When somebody bends forward in this direction, it tightens the posterior capsule, and the condyle glides posterior, lateral, and slightly cranial, tightening that posterior capsule. Often people's poor posturing allows that capsule to tighten up, so we have to use the mobilization technique to try and stretch that dorsal capsule. I get these patients who have cervicogenic headache. There are headaches coming from their neck, and through the testing that we teach in the class, we learn that they have a limit in their motion of their occiput C0 on C1, and often because of the posture of people holding their head like this all day, they get tight in the back. So we need a nice, easy technique to help us reduce that dysfunction, help them move better, and reduce their pain. So the way we do it is we place them sitting. I like to support them behind their back. I like to fill the space between me and their head so I don't pull their head towards me. I'm going to use a supinated hand underneath their occiput. I'm going to block C1 at the transverse processes. I'm going to bring her back a little bit in retraction, so bring your head back like a turtle. There you go. And I'll usually drop it down into a little bit of forward nodding while I rotate her a little bit to the right side nodder, and then I'm going to move the occipital condyles in a dorsal, lateral, and slightly cranial direction to allow them to glide out of the sockets of C1 this way. And I'll oscillate towards the end of the limit, and then I give a little bit of stretch, hold it up to 30 to 40 seconds, allow a little nodding to occur, and at the end I'll ask her to look down and to the right with her eyes to help promote that with the neuromuscular system. And at the end, I'll go back, retest the movement, and reassess the impact of that on their headache. Very easy technique. Monday morning I can use this, and often the client feels better within that first day.